Hi, everybody. Rob Carpenito, Broadway Medical Supply Team Broadway, finding solutions together. Welcome to the broadcast. Today, I have the privilege of having two guests in Studio B. Kelly Bento from Soleil. Kelly, welcome.
Thank you.
And as always, my brother from another mother, Dr. Thomas Seager, CEO of Morozko Forge, Associate Professor of Sustainable Engineering at Arizona State University. Welcome, Thomas.
It's nice to see you, Rob.
Great to see you again, brother. I'm super excited about our newest collaboration with Team Broadway, Broadway Medical, and Soleil. Kelly Bento, the CEO and president of Soleil. Kel, I have to tell you, after spending some time with you today, you guys have some product.
Thank you. I agree.
If I don't mind saying. I want you to talk about why Soleil is the standard in the red light industry. I mean, I'm a neophyte to it. I know very little about it. Tell everybody why Soleil and red light is the way.
Because the unfortunate truth is that the red light therapy industry is fully unregulated. And I didn't know this when I was a practitioner and also a consumer purchasing red light panels for myself, my patients. And once, like many industries, when you peek behind the curtain, you learn quite a lot about the industry itself. And so when I was, as a clinician, when I was vetting different companies to have my patients use their red light therapy, my first question, with my understanding of the mitochondria and how it is the ultimate environment sensor. So for me, that puts safety at the top of the list of things that I needed to vet with these companies. And so when I was asking them about their products, my first question was, how are you testing? Tell me about your testing, your quality control, and fully verifying that they are exactly what you say they are from a wavelength standpoint, from an irradiance standpoint, and from a safety standpoint. And some of them laughed. They thought that was a bit funny, which was shocking and horrifying to me. And essentially what I found out was that everyone is just relying on the manufacturer, which they're all Chinese manufacturers for all of the red light therapy panels. And they were just simply relying on the Chinese manufacturer to tell them that they were what they said they were, with no verification by the company themselves. And so, I immediately shut down all recommendation to all red light therapy companies, knowing that. And I have a lot of very smart friends, and thankfully, I have a genius husband, and with the support of people around me, saying, "You know more about red light than anyone I know. You should do this," and so I did. And so I set out to make the red light that I wanted, make the red light that I wanted my patients to use, and make it effective, but also to make it safe. And then I had my friends that were practitioners that were saying, well, I want my patients to have what you're making. And so Soleil was born and became a company where we're now, supplying a lot of people with the highest quality, fully tested, fully verified by me, by my staff, by my company. Everything is verified and tested here in the U.S., and nothing is left to chance. Nothing gets drop shipped from China. Everything gets tested, and then it lands at the customer's door, which I don't call my customers customers. Everyone is a patient for me.
Mm-hmm. I think that's great. You know what I think? You know what I found even more interesting, and Tom, I'm sure you can collaborate a little bit more. Kelly's backstory and how much it parallels yours, how she ended up actually getting starting this whole journey. Kelly with her brother, and you with your son with type 1 diabetes. I just thought it's just a collaboration that was just meant to happen.
Are you going to ask her to share that backstory with our audience?
I was kind of hoping she would chime in, but Kel, if you would, I mean, I just think it's such a great story, and how it blends with Tom's story, and it's just it shows you guys are just real people, real backgrounds, and looking for real solutions, and it just all ties in. Can you go into that a little bit, Cal?
Yes. Unfortunately, my brother suffered a brain injury 14 years ago, and I was a young mother, and I was already interested in health and wellness because I was raising a family, and my family's health was paramount to me. So I was already interested in exercise and nutrition and all of that. And then with my brother's injury, I started to understand the deeper levels of what is required in someone with that level of a medical condition. And so I started doing a lot of research. I started understanding the mitochondria, because that ultimately that is what powers the brain. It's what powers our bodies. And so I needed to understand, okay, with a brain injury, that's a mitochondrial issue. And so I was seeking out information about how I could help him, because essentially the greatest hospitals in this country, all of the Boston-based, Mass General, Brigham and Women's, Spalding Rehabilitation, these are the best hospitals in the country. And after 100 days of being in the hospital, they handed him back to us in a wheelchair, in diapers, and essentially said, this is as good as it'll ever get. And they also said that he had, at that level of injury, that he probably had a 3 to 4 year lifespan.
Wow.
And it's 14 years later, and I think he's Benjamin Button. I think he's reverse aging. Unfortunately, he will never get up and walk across the room, but he's doing extraordinarily well, and probably should have been written up in medical journals. He is loved by all of his doctors, and they are just astounded at what I have been able to do with him. And I've been able to do that with red light therapy.
Red light. Wow, that's great. And Tom, it's just something how this kind of parallels your journey. I know with your son, you went through quite a bit with his type 1 diabetes, and you want to talk about that?
I didn't know anything about nutrition or metabolism or mitochondria. And I remember when my son's pediatrician handed me an orange and a syringe. I was in the hospital outside the pediatric ICU, and Dr. Dewar came up to me. He said, your son has diabetes. No one is leaving this hospital until you figure out these. What they used to do is they have to teach the parents how to draw up the insulin and practice injecting it into an orange. That's what he was talking about. I had to learn how to measure his blood sugar, dose his insulin, mix it in the syringe, a combination of H and MPH, and then practice injecting it. The standard stay for a pediatric type 1 diagnosis is like 3 days. We left after 2. There was nothing left to practice. There was nothing left to do. Hospital did not want to discharge us because it didn't meet the standard. I didn't have any health insurance. I didn't want a big bill, and I didn't want to get charged for another day. So I said, I understand you have your standards and I have mine. And we walked out. I felt like I was going to have to do this by myself. I was going to have to learn everything. Could not rely upon the endocrinologists or the nutritionists or the doctors to manage this for me. that my son's life was in my hands. That's the way it felt to me. And I've been on a learning journey ever since. That was 25 years ago. Teach me about the Atkins diet, about the insulin response, about mitochondria, about vitamin D, about autoimmune disorders, et cetera, et cetera. The feeling I had that I was going to have to figure it out all by myself, it turned out to be prescient. That is, the recommendations through the American Diabetes Association are terrible. The dietitians don't know what they're talking about, and the endocrinologists are unreliable. I was doing a lot better reading the journal articles, going to the library, and tracking my son's data in his own journal than I was listening to any other of the so-called experts. By the time the government shut down the country and the campuses for COVID, I'd already had a skepticism that we couldn't trust our professional societies or even our universities. And you know, I'm a university professor, and certainly not the federal institutions that were supposed to safeguard our health. It was my son's experience with diabetes that taught me to be skeptical and take charge of my own health. That's the approach that got me into the ice bath every day, because I got that elevated PSA report, and I'll be damned if I was going to go to a urologist to have them take my prostate out. By that time, I was like, I will figure this out myself. And now I think I see what you mean by the parallels, Rob, because the doctors handed Kelly her brother and said, "That's it. Is as good as ever going to get. He's going to be dead in 3 years." And Kelly said, "You know what? I'm not gonna sit around and wait for your prediction to come true. I'm gonna find out how to take care of my brother's brain."
Exactly.
That's
Right.
great. That's really great. Now here we are coming into another world that I think is a long time coming in proactive wellness. As far as I'm concerned, I'm here with the two biggest names in proactive wellness, with the two biggest products that I feel can benefit many of my clients that come in pain, that are looking for a better way. And what better way than cold and light? I mean, the two most basic forms of exist. I mean, basic forms of existence. I mean, the two things that are easily accessible: cold water and light. I mean, go outside, go. Go in your bath in your shower. I mean, there's nothing better. How do you think we can make the biggest impact between the two worlds, Tom? How can we marry this? And Kelly too. Let's talk about how we can marry these two beautiful forms of therapy, cold water immersion and light, to really help people. How can we do that?
Well, essentially, combining the two is going to keep people away from the hospitals that and the doctors that failed both of us, and that should be everyone's goal. Your only offense in the world of medicine today is to stay away from them, essentially, because you're in a lot of ways better off, unless it's obviously an acute accident, in which case they do a beautiful job at saving lives in those situations. But when it comes to any level of chronic illness and prevention, you're on your own. And so, cold and light, combining the two, we can keep people away from that system for pretty much their entirety. And so that should be the goal. And the synergy with the two is absolutely extraordinary. I mean, it's a perfect marriage. Cold builds the capacity, and then light builds the efficiency of the system. So,
Wow.
you know, we're we're going to help a lot of people.
From a physics perspective, cold and light are the same thing. I mean, cold is our experience. It's our sensory experience. But if you think about the thermodynamics, there's really no such thing as cold. There's only less heat. Cold is an absence of heat. Heat is infrared light. This is what a radiative heat is. It would be thousands of nanometers in the wavelength. It shouldn't be any surprise, Rob, that cold therapy and red light therapy complement one another because the absence of heat when we immerse the body in cold water, that heat has to come from inside the body now. It's the mitochondria that are responsible for that heat. In particular, the mitochondria in your brown fat. Although muscles also create heat inside your body, the mitochondria are taking the metabolic substrates, glucose, triglycerides, and via respiration, they're combining it with oxygen to release this heat inside the body. And here's one of the things that very few people realize when the mitochondria are producing that light, not all of it is in that radiative part of the infrared spectrum. Of course, that's the part that keeps us warm. But some of the light is also in the shorter wavelength UVB. This is roughly speaking about 300 nanometers. When your mitochondria inside your brown fat are making UVB light in response to the cold, that light will intersect a cholesterol molecule, change its structure to create free vitamin D. And that pre-vitamin D will be further metabolized into all the complex forms of vitamin D when your body is ready for it. The point that I'm making here is that cold therapy is light therapy from the inside of your body instead of from the out. Of course, Kelly and I should be working together.
And of course, we should be introducing it to a different sector, the wellness sector. So I think at the bringing it to a show like the Abilities Expo is going to be a big thing, and I know Kelly's really excited about being a part of it. I know Tom, I know you are as well. I know I can't wait. I can't wait to uh, you. We get to actually reach a whole different audience and show them that there is a better way. And I have two pioneers that I'm lucky enough that I get to work with. And between the three of us, this synergy together, we can save a lot of lives potentially.
I agree. It's widening the scope of what an entire industry has thought possible. You know, they've been focused on what what was within the allopathic system, and we're stepping outside of that allopathic system, and we're essentially providing therapies that the human body has understood since the beginning of time, cold and light. And these are things that modern living has separated us from because our life of convenience has extracted us
Yeah.
from having to go into cold water to fish and to forage and to find things, and living indoors, and also the paradigm of stay out of the sun and stay inside and stay away from sunlight, has we've literally just photonically starved ourselves through the convenience and through the misinformation of the sun being unhealthy. We're driving disease by staying warm and by staying inside forever and ever. The human biology is degrading rapidly.
It's so frustrating because you hear about stay out of the sun and I'm afraid of the cold. Oh, I don't like the cold. But but like you both have said, this is the shortest distance between 2 points, in my opinion. You get more from less with both. I mean, Tom, what do you think?
Kelly has described it so well. You don't have to go back more than 70,000 years there's a enormous volcanic eruption. It spews ash into the atmosphere and it creates an ice age. Now, the oldest human fossils are in East Africa on the equator. So sometimes people will say to me, Professor Seager, I'm from an equatorial latitude. I'm not from Norway or something. Why should I get cold? But they forget that during the ice age, the entire glacial caps, those mountains in East Africa, were covered with ice. Our ancient ancestors foraged in the water. How did they survive the ice age? By fishing, by eating seafood. It feeds the brain with the short chain fatty acid. 60% of your brain is made out of cholesterol. You need that aquatic nutrition, the plants, the shellfish, the finfish, and it's how our ancestors came alive. How did they get it? They didn't have trawlers. They went wading into the water. They went swimming. The mammalian dive reflex is an autonomic response that slows down your heart rate, that prepares you to dive so that you can forage and get the food you need for your family. So some ancient grandmother was gathering shellfish in a glacier-fed, icy cold stream on the equator. And she brought those shellfish back to her family and she boiled them up in water by the fire. So, what's the sequence? You get cold, you have a short walk, a little bit of light exercise, and now you have red light and infrared from your fire, and you eat your seafood. That's the way that she did it. And our mitochondria are descendant from her. All right, let's take a look at the modern paradigm. You get your phone out, you DoorDash some Chick-fil-A, and it shows up half an hour later, costs you $75, and you eat the chicken that's swimming in the peanut oil. Who do you think is going to be healthier? I'm sketching out these two scenarios to say our lives are too easy to keep us healthy. What our grandparents used to consider a hardship, we now do for therapy. It's amazing.
I'm actually blessed enough to have, again, two pioneers in their sectors, as partners, in Kelly with Soleil and Tom with Morozko, and just the how excited I am to be able to present this to my clients at Broadway Medical, and as Broadway Health and Wellness, as this sector is going to be known as, to actually show different solutions that they can use with their restorative therapies, and marry two worlds where hopefully their bodies will learn how to rehabilitate themselves. So again, they can add some quality of life, and just by having access to people that are really in the know on what the benefits are and how we can get them home to where, again, we can add some good years to their lives. Kelly, where do you see this going as far as down the line in the wellness sector? I mean, do you think we really have a good shot to make this a standard, or are we going to be fighting against the medical community? What's your opinion on all this? I know it's kind of a loaded question, but
Right. Michael Hamlin, the leading researcher in photobiomodulation, was asked the question, well, if red light can do so much for people, then why isn't every doctor prescribing a red light therapy panel to their patients?
and again, why aren't they, in your opinion? Or an
Well,
ice bath, even, for that matter.
Right, exactly. And so, what he had said was, well, if the patient walked in there and they prescribed a red light therapy panel and that patient never needed to come back to them, then that breaks the medical system. That breaks their business model. And essentially, I've seen light do extraordinary things. in my own practice, in my own family, certainly. And people need to understand where red light therapy is often described as, someone having a light deficiency. And that's it's sort of an interesting way. I usually don't phrase it that way, but that's an interesting way of looking at it. But I do want people to understand that as humans, like Tom just laid out, how you would have to go into the cold water and get that food. Our biology was designed that we would be naked and we would be outside every minute that the sun is in the sky. And every minute that the sun is in the sky, it is providing you with photobiomodulation, with red and near infrared light therapy. Nearly 42% of the sunlight is in that red and near infrared spectrum. So that's a huge signal that much of sunlight is in the red and near infrared spectrum. That made me think, okay, so in nature, by design, that's awfully important that much of it would be in the red and the near infrared. And then when you start to understand when the light comes through the atmosphere and that the visible spectrum of light, the red, orange, yellow, green, blue, purple, violet, is being absorbed by all of the vegetation around you. So all of the plants, all of the greenery, the shrubs, the trees, the grass, all of the vegetation around you is absorbing the visible spectrum, and it's reflecting the near infrared spectrum. Again, another huge signal from nature that nature doesn't want to take that light. It wants us as humans and animals to have that light. So the true spectrum of light that we are meant to receive as humans, covering every part of our body without clothing on, is about 80 to 90% in the near infrared. So it's insanely important, and we are so extracted from it when every minute we're supposed to be in this light. And the average American, 94, 96%, they're spending inside, extracted from those beneficial healing wavelengths of light. No healing can take place when you're sitting inside, when the window glass filters out all of the near infrared, and you're being bombarded with, ultimately, this is an alien sun. This is not, a biologically recognized light that humans would have been exposed to at any point, anywhere. So I think for people to understand exactly how little light they are getting and how much light they need makes the case for a red light therapy panel, because not everyone can sit outside all day long and bask in the sunlight. I wish. I mean, I've tried to design my life to be able to do that as much as I can. I hope that everyone would design their life to do that as much as they can. I constantly tell people, do not buy a red light therapy panel. Go outside. Spend more time outside. You will get photobiomodulation simply by being outside. But the unfortunate truth is we have a lot of very sick people that are stuck inside and they cannot get outside. Like my brother, that is where red light therapy has become, extraordinarily valuable for him. And most of us have to have jobs. We have jobs that keep us inside, that keep us extracted from that light all day. So, I would love for everyone to be able to design their life and live outside. That's not the truth.
That's not practical. But you know what's great? I have two great partners that talk about. We don't. Not once have we talked about the transaction part of it. We're not talking about a product. We're talking about the solution, the transformation. And I think that's great. And I think that's what people really need to hear is that, you know what, there are manufacturers that truly care, that are into it. And that's what Broadway stands for too. We're finding solutions together. And I think the way we're doing it, I think we're going to help a lot of people. What do you think, Thomas?
I think Kelly's describing this so well. Humans were created for the Garden of Eden, not the desert of Eden, not the skyscraper of Eden, not the asphalt parking lot outside the Walmart of Eden. We were created for the garden, and the garden does reject all of this infrared light outside the spectrum. The plants, they use the light to photosynthesize. But there's one narrow aspect of the visible spectrum that the plants also reflect. And of course, it is green. Those gardens, those shady forests are green. And so every living system into which human beings are meant to thrive, and I'm not talking about Phoenix, Arizona, where I live, I'm talking about the lush green forests of the world. They are rich in infrared, particularly near infrared and green light. I like what Kelly's saying about go outside. In Phoenix, Arizona, it's 115 degrees outside. And that's not even on the pavement. There are vitamin D deficient people in the sunniest city in the United States because they won't go outside because it's so damn hot. There is no shade, there is no green. And so the machines, you were talking about the manufacturing solution, the machines that we bring indoors with us, they are meant to create a little bit of the natural environment. We like to say at Morozko, it's the next best thing to nature. I'd much rather that people were in the Pacific Ocean. We don't have that in Arizona. I have a Morozko. I live in downtown Phoenix. So I have a Soleil wellness red light. I have a My green light. I create an LED forest. And it's a poor imitation of the real thing that I'd have to drive 2.5 hours to get. But the benefits from those LEDs are real. My body is still going to respond to the machine light because it is so much better for me than the fluorescent or than the daylight that is coming through the triple glazed window that won't let any infrared pass because I just have to run my air conditioner harder to keep the indoors comfortable in a city like Phoenix.
Basically, a lot of this is fixable if we just get our rear ends outside, basically, and stop. Life isn't a spectator sport. Outside, get in the ocean, get some good grounding in. Um, get yourself cold, get a little uncomfortable.
Agreed, Rob. But what you're doing in your showroom at Broadway Medical is you are creating the technological version of the Garden of Eden. Here's your cold water. Here's your minerals in the water. Here's your grounding. Here's your red light. Here's your green light. You have built inside your showroom this the next best thing to nature, the healing environment that will return people to the Garden of Eden that we lost thousands of years ago.
That was really why I had this idea to to bring in another aspect of wellness, so people had a choice.
Mhm.
You could have your Shawshank moment. You could either get busy living or you get busy dying. But you know, I was totally enlightened today, Kelly, with everything that I've seen. I don't see where this isn't going to be a benefit in every aspect for all of my/our clients. Same with you, Tom. Everyone that I speak to about Morozko says the same thing. I mean, the just the thought of what good can come out of their lives by just getting themselves some cold. I mean, we're getting a lot of great feedback. We're just starting to scratch the surface of what people are seeing as far as value in Morozko. And I know going forward, Cal, I know once we open the doors and we really enlighten people on the benefits of Soleil well, I think we have the ultimate 1-2 punch for keeping people alive and bringing some quality of life. What do you guys think?
Agreed. Absolutely.
Yeah.
Of course. Kelly, I want to ask you a question. How do you choose your wavelengths? These LEDs are tuned to narrow wavelengths. The sun is a broad spectrum. And so when you're building a machine and you're saying, well, I want this wavelength and I can't get the whole thing, I'm going to choose this one and this one. What's that process of choice like for you?
Most of it is based on what the research has shown. I believe the next 10 years in the world of photobiomodulation will be the most interesting because we need to start paying more attention to all of the wavelengths. The red and the near infrared have gained popularity for their healing capacity. They're highly, highly studied. I think the next 10 years will be really the most profound in that exploration of what how do we make that better? How do we provide light therapy that is ticking all the boxes, that we're paying attention to everything, not just the red and the near infrared. I mean, I love what Tom is doing with the green. I mean, there's
Yeah.
the science that supports that as well. Really extraordinary, but that's taking a page from the book of nature, where nature bathing is shown, it's scientifically shown to be beneficial. Not everyone has access to a forest. Many people are living in cities. I just spent the afternoon in New York City. There wasn't a tree in sight. There wasn't a leaf or a tree or a blade of grass anywhere to be found. So, different wavelengths do different things. My products were based mostly on the current research that is going to evolve, and therefore the products will continue to evolve into what do we know now? Where are we going with this? And photobiomodulation is there will be a device in every household, I believe, because it's easy to do. It's safe, it's profoundly effective, it's easy to do, and it's beneficial for everyone that I've ever known that has ever utilized it. And so, what I'm doing with red light, what Tom is doing with green light, these are all, really, really important areas to utilize now and to be explored even further.
Like I said before, I am so excited to introduce this to the masses. The masses meaning the people at these expos. Give them a new appreciation for light, for cold. I know Tom Morozko's also has a mineral bath, which again, it's going to mimic, which basically mimics the baths, the hot baths and the hot springs, which is another big benefit. So there are products out there. You know what, guys? I'm excited to just bring this to everybody and getting everyone else excited.
Well, let me challenge Kelly a little bit on that. Because at the expo, I think this is the Abilities Expo. We're talking about people who are looking at wheelchairs, scooters, hospital beds, lift chairs. Now, Kelly, you work with a lot of professional athletes and sports teams, whether that's the Bruins or the NBA or college teams like Harvard. What do people at the Abilities Expo have to learn from these elite athletes who are already, abilified? They have the most wonderful capabilities. Can we help people who aren't professional athletes?
Absolutely, and I prove that with my brother, who is bedbound, who is wheelchair bound. It's literally saved his life. I would love to be able to get him into a cold plunge, get my brother into a cold plunge. Unfortunately, I can't do that with him, but I can utilize red light therapy for him. And so, for elderly people that are not ambulatory and they're not able to get outside, and for disabled people that can't take advantage of nature. This is a therapy that it's steeped in nature, but we're leveraging modern technology, which is, a great thing that we're able to do. And so, through with the physical therapists and all of the people, that I'm working with, professional athletes are looking for that slightest edge. Football is a game of inches. Hockey is a game of edges. They are looking for that 0.5%, 1% improvement in either recovery or performance. For those that are sick and bedbound and really, really in need, that's where you see the biggest benefit. In someone that their health is really, they're really struggling, and they're very light, photonically starved. When you can put light on someone that has no contraindication, so you're not concerned, is this going to interfere with this medication that they may be taking, or will this interact with something else? There are no contraindications. It's valuable for children. It's valuable for elderly. It's valuable for healthy people, and it's far more valuable for those that are sick and bedbound.
Yeah, I was telling you today, Kel, I get calls all the time from people that say, Rob, I'd love to be able to come see. I can't get out of the house. So you know what that means. You're not getting out of the house. You are getting literally zero benefits from light, you're not getting the cold from the outside, even the cold from the outside air hitting you. You're not really getting much of anything. You're literally living a slow death,
right,
as I like to
their
call it.
Systems are typically very fragile, right?
Yeah.
They're very fragile. So, if you can take light and build their system, build their battery a little bit, build their efficiency a bit, then maybe you can move them toward building the capacity by getting cold. Those are things that you can kind of start with one, and then build yourself up so that you can get to the other. So
Prior to pharmaceutical-based medicine, there was a tradition at hospitals. Sometimes they were called sanatoriums for tuberculosis patients, for example. There's a tradition at hospitals to wheel the patients outside, even in the winter. So they might send a tuberculosis patient to New Mexico, to the mountains, or to Colorado, or to the Catskills, for that matter, to recover. And they would recover in the cold air and sunshine, because there was an understanding that this was healthy. This is before you pump people full of antibiotics. And I'm not knocking antibiotics. They're a wonderful thing. What I'm saying is that pharmaceuticals have given us the illusion that somehow we can live without the outdoors, without the sun, without the cold, without the seasons. We just have pills and drugs that'll do it for us. And it's not true. Clinical studies support exactly what Kelly is saying. We can take a lean, healthy person and improve their insulin sensitivity using an ice bath a little bit, 10%, 15%, enough to get a signal. But if you take an obese, type 2 diabetic, middle-aged man, you can improve that insulin sensitivity 80%. He's not going to win the Stanley Cup. He's going to get up and he's going to go for a walk around the block. And for him, that's like a trophy.
Wow. I'm going to start wrapping up. So, Tom, do you think there's anything else we should touch on?
I think there's so much more that Kelly and I can talk about, for example, the mitochondria and how cold stimulates it. Red light seems to help recover it. I come out of my Morozko, and of course, I stand in front of my red lights. The red lights are not hot. My skin feels warm. Kelly, can you explain why I feel warm in front of a red light that isn't hot?
Because the red light is, as you said, it's acting on the mitochondria, and your mitochondria help your body to produce heat, internal heat. So we did that downstairs when we turned the panels on, and we turned it on. And he said, "Oh, it feels nice and warm." I said, "Touch the panel. It's not emitting heat. It's prompting your cells, your mitochondria, to do what they were designed to do, which is to produce heat."
I'm really looking forward to after my morning immersion. You know, I do my 4 minutes, and then once I get out, shiver for another 20. It's going to be I'm looking forward to that totally different experience and the positive effects it's going to have. Again, just from that 1 minute of standing in front of the light, knowing how much more it's going to help me, but more importantly, when we touched on things with people with lymphedema and edema, and while they're basically sitting, they're still getting their therapy. That's huge.
Mhm.
That's really really big. And more importantly, like I said, in the cold sector, when I come out of my cold bath, and instead of my body shivering to get warm, I'll actually be able to have the benefits of the red light therapy, which will only further enhance what I've already got from the cold. I mean, Tom, it's the perfect storm of health. No?
I think it's so wonderful the way Kelly is explaining it. People will be surprised to hear what I'm about to say, but nature is wasteful. People don't think about it that way, but a salmon will lay 3,000 eggs, and two of them, will grow up to be adult salmon. The sun has a full, complete, complement of infrared wavelengths, but that doesn't mean that the mitochondria respond to all of them. So this gets back to the earlier question about how do you choose the wavelengths. There's a lot of wavelengths that the mitochondria are not equipped to respond to or absorb. The way the mitochondria are constructed, they have certain chemical bonds. Those chemical bonds will respond to certain wavelengths. Nature can afford to be wasteful. You spread 1,000 seeds and 10 of them grow up into plants, and those plants make 10,000 more seeds. But in manufacturing, we cannot afford that waste. We must find the wavelengths that the mitochondria are going to respond to and produce just those wavelengths. And I think this is the research that Kelly was alluding to, as we get better at knowing where in the body we're trying to target and what wavelengths we need to target that organ, to penetrate enough skin to get there, whether it's the brain or whether it's an organ like the liver. The more we know, the better the machines are going to get, the more efficient they're going to get, and the easier it's going to be for the patients to use them.
That's you know what? I think today we've really touched on a lot. We've spoken about the need for red light, how important it is, just to get that feeling every day of sun on your skin and the rehabilitative effects, along with how it would work in conjunction with cold, the benefits of mitochondria in both areas, which again, now I'm finally getting up on the mitochondria too, which is another good thing.
You're essentially going to recreate what a caveman would have done when he would have submerged himself into the cold water, come out, and then stood by his fire to warm up. You'll be recreating that tomorrow morning when you step out of your cold plunge and then you step in front of your red light panel.
I can't wait.
So when Rosa calls you a caveman, you'll take it as a compliment.
Well, wait a
You
minute.
probably already do. That's it.
There we go. Rob the caveman. We're ready. Well, listen, guys, I appreciate you making the time today. Kelly, I appreciate you making the trip down. It's been an honor and a pleasure. Looking forward to
great
the great. It's going to be a great collaboration. Tom, as always, I appreciate the time. I appreciate you being on, and I'm looking forward to my visit to Morozko, Morozko Forge on Monday. We're going to have a lot to see and a lot to talk about, and I'm really looking forward to it. But I want to thank you both again for making the time.
Thank you.
We're going to see you soon, Rob.
All right, pal.
Great to see you, Tom.
It's good seeing you, Kelly. Thanks for talking.
All right, we're good.